Jacques reporting for you. You don't recognize me? Yeah, I should have shaved, but I was on a mission for the pharmacy. Where is the nearest pharmacy? Oh, we have to make a thumbnail out of this. Yes. Where I was on a mission to the nearest KFC. No. We can make our own chicken better, or our own secret recipe. I can make my chicken better than that. Maybe it's my diet. My diet is not the best. I do eat some noodle soup, some street food sometimes, but I always like to eat the fried chicken. I fry my chicken myself. And then I go sit outside immigration. I go sit outside immigration in the morning, 8 o'clock, waiting till it gets 8:30. Actually 9. Yeah, with 13 degrees Celsius in the short pants, with a lot of foreign people all around me with a sneezy nose. So I did catch a cold. And when I catch a cold, Pimmy will catch a cold too. And then we're all sick. So I was sent out to do the pharmacy job because it's only last one day. And then we pump in a little medicine. It's like a candy shop. If you know what you want, you just come with your shopping list. They ask if you are allergic. No, I'm not allergic to anything. Not antibiotics, not anti-inflammation, not everything. You can get whatever you want. It's like a candy store. A candy store, a pharmacy is like a candy store in time. That's why there are so many pharmacies. You don't need a prescription. I'm Dutch, that's not my natural language. That's why I'm talking so slow. Prescriptions, it's not my language. You don't need a prescription from your general doctor. You don't need the doctor's advice at all. You just go to the Google. And you go to the pharmacy, pay, and get whatever you want. So I will continue this topic, not on this location. The little red one is going to bring me back. Where did I leave the little red one? I leave the little red one over here. Next to some big red one. Looks familiar, but it's probably not the same. Here, Chiang Mai, Thailand. What's the time? I have no clue. No clue at all. It's somewhere 12 o'clock? No. 1. Flip it. Flip location. Go somewhere else. Take your motorbike. See you later. This is not the end, This is not the end. So, okay, we did notice getting medicine in Chiang Mai. That's easy if you know what you want, if you are what you need. If you have it before, maybe you catch a cold before, or a Belgian disease or whatever, and you know what you get because you went to the pharmacy and you said, I have a sore throat, I have a pain in my head, I have inflammation in my jaw or something like that, and then he gives you medicine, he gives you antibiotics and anti-inflammation and a variation on the paracetamol, and it's working. So the next time, 2 months later, you get the same symptoms. Okay, catch a cold, something like that. You go to the pharmacy, you say, this, and this, and that is what you get. Even medicine against tuberculosis, the tering. I don't think people have tuberculosis anymore. You get tested at some occasions when they want you to have an X-ray when you come inside a country or something like that. I think it's even a requirement if you want to have a tourist visa or a long-term visa for the Schengen, something like that. They were talking about tuberculosis. Nobody has tuberculosis anymore, but here you get medicine for tuberculosis. But I told you I like dogs on the barbecue, but cannot walk around without setting off the alarm system. I do like dogs, but not as a watchdog. Back to the topic, the medicine is easy to get if you know what you want. Just say what you want and you get it. Or even you can get an advice. You can get a good advice from the pharmacy, because the pharmacist is a professional and he knows his job. And once I had a problem in the Netherlands and they couldn't solve it. They couldn't solve it with blood examinations. 3 different values in my blood were examined at the lab. The result was 0. General practitioner, no idea. Dermatologist, difficult word to pronounce for me. Dermatologist, he had no clue. He said fungus. Now I know fungus. It was no fungus. Another doctor, internist, he made an echo of my intestines. I had beautiful lungs, a small but healthy heart. Slank, he said. Beautiful heart I have. Not fat. But they couldn't find it. They couldn't find a solution. I had some inflammation in my hand. I could show it. I never could show it because when I see the doctor it was gone. But when I show it, when it's occurring to a Thai pharmacist, she said, that's inflammation of your nerve ends and you have to take this. Now within 2 days it was gone and it never returned. Yeah, so the pharmacists, they are good. But now, if you don't know what you have to see the doctor. Go see the doctor. Go see the doctor. Now, seeing the doctor, you can choose to go to a clinic. Cannot make videos inside the clinic. They don't appreciate it when you show all their patients. But going to the doctor, going to the clinic, you can go to a clinic around the moat, for instance, at the corner of Sri Donchai Road and the moat. Just around the corner, that's 100 meters, 200 meters, there is a clinic. I can recommend the clinic. The doctor is a very nice doctor. He's a good doctor, he's good advice. A consult is cheap. A consult will be cheap, but the medicine are not. But that's the thing, all the not registered medicines, special medicines, Western medicines, they are not cheap. So the bill of the doctor is rather high. But he gives good advice and he keeps me away from the hospital. Because that's the second choice. If you don't know what you have, you can go to the hospital. But you can choose whatever hospital you want. You can have a private hospital and then you have to pay the bill. Or you have to be insured. It will be a different topic, being insured. What insurance do you want? What insurance do you need? I asked for several quotes and there is a lot of choice, but yeah, you never know what to choose. And many health insurance, they say pre-existing diseases are not covered. Now it's always about the pre-existing disease, so it's not covered. Most of those health insurances, they are nice to for your visa. There are some visas they require health insurance, and then a health insurance like that, it can be a thing, but not for real. It's better to save yourself. You already have your funds because you have to survive. You cannot go broke. If you want to go to Thailand and live in Thailand, don't go broke to Thailand. You have to have your funds. And again, most visas, they require funds. Retirement visa 800,000, marriage visa 400,000. If you don't have to show it up at immigration, you can use it to go to the doctor. So 400,000 to go to the doctor, they can do a heart surgery in a public hospital. An academic hospital, I like to go to the academic hospital because they're cheap and they are the best doctors. Only thing, you have to wait. You have to wait a long time. Now we're gonna go to the hospital again We cannot film inside, but okay, we give you some footage outside. Wait for it. The next day, something like that. Okay, a sneak peek inside. Waiting is the norm. You have to wait. You start with waiting, and you end with waiting. But no, it was better than I expected. I was asking for an echo, a radiograph. No, it's an ultrasound, and I just wanted to make an appointment, but they say you can see the doctor today. You only have to wait. So we were waiting for the doctor. Here's a view outside the hospital. It's an academic hospital. They did help me right away the same day. They did the echo, and yeah, that's a completely different price than an echo in a private hospital. My fancy doctor was talking about making an echo at the private hospital. Oh, they can help you the next day. It's no problem. I did several others this week before, and it's only 20,000 baht. 20,000 baht is 660 euros. They can amputate my leg for 660 euros. But no, this was at the academic hospital here outside. We're uh, we're waiting for the doctor, and the doctor. Yeah, there is a procedure with numbers, um, and he sees me. He makes the radio echo, ultrasound, and he didn't find anything, and that was a positive thing. It was a positive thing, and and then he said, "I sent you to a specialist." I sent you to a specialist. I sent you to a specialist today, but it was too late because we are not aware. We were helped the right day, so we were not that early, and it was already 3 o'clock, something like that. And the specialist was gone already. But we have a next appointment. We have a next appointment for Monday, and that's again very quick. And this is the academic hospital with the best doctors because they teach other doctors. Now that's the thing. There is some waiting involved. You have to get your number, then you have to wait. Then you get another number. There is a lot of waiting involved. At the end, the bill was 100 baht. A consult with the doctor is 100 baht. That's 3 euro 30. So yeah, I recommend to go to an academic. Thank you for watching. See you later.